Capitol Report is a production of Senate Media Services.
Coming up, the death of George Floyd brings to the forefront policy efforts to improve racial equity and safety, plus curbing the high number of COVID-19 deaths in Minnesota's nursing homes and garnering the resources to continue the fight. All of this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. As protests continue following the police officer-involved death of George Floyd on Memorial Day, policymakers are renewing their efforts to address racial inequities and reform police practices. Earlier this week, I spoke with Senator Jeff Hayden, who represents that area of Minneapolis.
The New York Times recently wrote a piece about the Minnesota paradox, outlining, as a liberal-leaning state, the disparities between the life outcomes of whites versus those of blacks. Governor Walz has spoken of how policymakers have been admiring this problem for years. Where does the state begin to address the paradox?
Well, that's a hard question. As a legislator, and I've been here for over 12 years, I feel like I have been doing this work even before I got in the legislature, and certainly since I got there. Shannon, you might remember a couple years ago, we had an equity package of work that Senator Champion and I spearheaded with former Governor Dayton that now has spent over $100 million trying to work on these issues, specifically around some education initiatives for those who've fallen through the cracks, some job training, as well as some entrepreneurship. A lot of that has gone into communities that now are devastated by this tragedy. So we, as African-American legislators and now a growing number of people of color legislators, have really focused on this and continue to focus on it. But we're going to need some help from our allies. We're still outnumbered in the legislature from an ethnic perspective. So we're going to have to gain our allies. And frankly, we're going to have to get some people from across the aisle. And so hopefully some of the issues that we're seeing here via this social unrest will really wake people up and allow them to focus in and become partners in this.
Now, regarding the actual incident, the death of George Floyd, you have called for the arrest of the three now former officers who were there as he died, and you've also called for Attorney General Keith Ellison to oversee all charges stemming from this incident. How will the Attorney General's involvement help in the prosecution of these cases?
Well, I think that Attorney General Ellison is a fantastic lawyer. He's seasoned, and even before he got into Congress and now the Attorney General, he was a practicing attorney. And so I think, and he's come from the communities in which are devastated by this impact. So he has a unique position of being on the ground floor, understanding what the situation, the background of the community, the backdrop, and so he's not foreign to that. The other thing is that the community was asking for that. I've received hundreds of emails from my district that said that this is what they want. And so I know that this gets sticky, and I'm sure that there are some really good attorneys at the county attorney's office, and hopefully they will be supporting the work that the AG does. But the community, frankly, had lost faith in the county attorney in which to do it. And so though that gets to be a little sticky, I think that they have a lot more faith in the Attorney General, and that is why I think that the governor made the move, because he was listening to the affected community.
Now, you talk about the stickiness, and then Senate Majority Leader Paul Gazelka told Minnesota Public Radio that he believes that Keith Ellison is too political, likely in part based on his previous service as a congressman, to handle this case. So does it concern you that whatever the outcome may be in the end, some will perceive the result as being political rather than impartial?
Well, I guess the first thing is, I think we've all watched, and if we haven't, it's because we didn't want to. So we all witnessed it. And that's a little different than in most cases in which there are a lot of evidence and a lot of, he said, she said, back and forth circumstantial evidence. That's about as far as I'm going to go be a lawyer. We witnessed it. We saw it. So it isn't as if this case is something that, happened in some place that nobody saw, and we're just trying to put the details together. We witnessed that. Secondly, President Trump invoked George Wallace in '68 and said, when the looting starts, the shooting starts. So I'm not sure the community feels that the U.S. attorney, and once again, I don't know the U.S. attorney or those folks in the Department of Justice. I'm sure they are fine lawyers. I saw her on TV. Sounds like she's a great jurist and has been a great judge. But the community, if you will, and I'm going to keep going back to that, would not have much faith in that process when the President of the United States is invoking a segregationist in his comments about political unrest in our state.
So you and other members of the People of Color and Indigenous Caucus, often referred to as the Pokey Caucus, have drawn a line in the sand. You have said that there, no votes on a bonding bill or anything else until some reform measures are passed. What do you have in mind?
Well, Representative Mariani has laid out a quite substantial list of things that he'd like to see. The minority in the Senate is in line with that and working on something that maybe won't be so many provisions for a special session, but it really talks about a lot of post-board reform, and that's the organization that licensed police officers, the way in which they license them, the way in which they get their continuing education, their ability to be able to revoke licenses of law enforcement officers who have violated those principles, much the same way we would do if a pharmacist was found hoarding drugs or a doctor was doing things that were not ethical. We usually pull those licenses and then investigate. It looks like now an officer comes under scrutiny. They're able, even if they go on administrative leave, they're able to keep their jobs until the investigation is complete. We want to, those are the things that we can do at the state level. We want to also look at the famous Stanek Rule, right? Former Representative Rich Stanek and former Hennepin County Sheriff passed some legislation that kind of repealed the ability for us to say that you have to live in the community in which you serve. And that has created quite a dilemma for us. In Minneapolis, 90% of the officers don't live in Minneapolis. So I don't know what the right number is, but I know 10% is probably not the right one. And I think most of us know that if we live and serve in the community, that we live in the community and we serve in the community, we work there, we have a different relationship with the community. I know I do. I live and serve in the community that I live in. I see my neighbors at the grocery store. So there's a different relationship. And we also are talking about the liability insurance. These big time police brutality suits are causing cities and municipalities to pay out a ton of money for the reckless behavior of their officers. The last Justine Diamond case was $20 million the city had to pay, and there's a lot more under that aren't so substantial, but when you look at them accumulatively, it's a lot of money. And so we want to do that, and then also work with the governor and work with the community to find a community policing model that gets into, especially communities like Minneapolis, in which there's been a systemic issue of police brutality and police misconduct, and to totally, go to a more creative solution on how we're going to community police, totally redesign that, really take a look at that, and not just nibble around the edges and go back to normal, because normal wasn't working. And unfortunately, there'll be another Mr. Floyd if we don't really dig in and get this right.
Senator Jeff Hayden, thank you.
Thank you.
Nearly $2.8 billion in federal and state funds have been directed to combat the COVID-19 pandemic. As cases continue to occur in Minnesota, public officials wonder if more funds will be needed.
Is there any planning going on, or is it too premature to know what's going to be needed as we get toward the end of the year? Obviously, there's next year's legislative session. Not quite sure as to how much money there's going to be there. And obviously, if the legislature doesn't act immediately, are we left short in terms of what might be needed over the next 6, 7, 8 months?
We believe that there are more uses of that money than there is of money available at this time. And we would not want to redirect it to the general fund before we feel comfortable that we've gotten through the surge. We sort of have a sense of how we're doing and whether or not there's any more federal money coming. So anyway, I guess our concern is that, we've got a number of working groups that continue to focus on areas such as the hospital surge issue, critical care supplies, alternate care facilities, critical care supplies that we know. At-risk populations are still an issue for us out there. The economic security, such as the small business grant program, social distancing process to make sure the businesses know and can open and be effective in their social distancing measures, food security issues, education and childcare. So there's a really long list of potential needs.
There's always the challenge that more needs will be coming forward, but would it not be more prudent to use some of those federal dollars that have come our way right now to backfill the $330 million in the general fund that the state legislators put out there, the governor signed right away, because obviously we were all very proactive, and that's what's helped Minnesota weather this better than many other states.
On February 27th, we announced a $1.5 billion surplus and a steady economy. And then on May the 2nd, we announced a $2.4 billion deficit with our budget projection. So in the span of that time, and part of that $2.4 billion deficit that we projected for this biennium, we included in that the $550 million, about the right number, $550 million of legislative appropriated dollars for COVID-related responses. So that is part of our $2.4 billion deficit. So the question becomes, as we go forward, when do we need to solve that math problem, and what is the best timing to use federal dollars to do some of that backfilling? As I said earlier, I think that may be the exact appropriate thing to do. We're just concerned about doing it now, because once we do it and the federal money is gone, there may not be any more federal money coming down the road. And so therefore we won't have the ability to use that federal dollars to respond to the surge that occurs in June or July or August. And
various communities need to have a tailored message that deals with their cultural issues, as well as hearing a message from a credible voice in order to make sure that they understand and have some clarity as to what is being said.
I appreciate your comments. One of the things we have found is that the coronavirus, the COVID-19 has not been universally spread around this. There have been really disproportionate effects of this coronavirus in communities and in different communities, and we need to reach out to those communities. We simply cannot assume, as Senator Champion articulates, that we cannot assume that everyone's getting the same message and the correct message and the accurate message and the constant message. And it's on us to make sure that all communities have equal access to testing, equal access to treatment. And this COVID-19 pandemic has really exacerbated some of the disparities that we already have seen in whether it's in education or jobs or healthcare. And it's really a tragic situation, and we have to respond. And as Senator Champion mentions, the media campaign is simply one of those methods. But the other methods are the mobile testing and other contact tracing components, where we really try to make sure we get out to all communities so that everyone has equal access to the information and to the treatment.
More than 80% of COVID-19 deaths have occurred in long-term care facilities. I spoke with the chair of the Senate Aging and Long-Term Care Committee, Karin Housley, about some of her concerns.
You have been critical of the practice of hospitals discharging patients with COVID-19 to nursing homes, and the Star Tribune editorial board agreed with you in this morning's paper. They write that a battle plan 2.0 is needed to protect seniors. There's not time to build new facilities. What can be done?
Thanks again for having me, Shannon. And I'm glad the Star Tribune editorial board agrees with me, because I've been saying it since March, that our seniors really need to be protected. 80% of our deaths are happening in long-term care facilities. And now that we're discharging COVID active patients to nursing homes, just doesn't make any sense to me. So we do need a battle plan 2.0. Battle plan 1.0 was a disaster. The governor and the Department of Health talked a lot, but nothing got done. And Nothing has changed. I had a meeting the other day with the Department of Health. We did a committee hearing, and there was still a lot of runaround, no answers. And you've got family members who want to see their loved ones that are in these nursing homes and long-term care facilities. It's been almost 3 months, and they haven't been able to hug their mom. Yet they're scared to death, and so are the residents, because are you discharging active COVID patients into a nursing home that who knows if there's any cases of it right now? We're working so hard to keep COVID out of our long-term care facilities. It doesn't make any sense at all that we're discharging hospital patients into nursing homes where we're trying to keep seniors safe.
So where should these patients go?
You know what? And I said from the beginning, we should have a designated building. Here, the governor and the Department of Health just spent $6 million on a refrigerated building so they could put bodies if our morgues were going to be over full. But that hasn't happened. Why didn't they spend the $6 million and have a COVID designated place for these people to go? That is still what I think should be done, but I don't think there's time for that because we've already wasted 3 months. Here we are 3 months in, we have a battle plan that's being talked about and nothing is getting done. These staff and these residents want testing. It's the only way we can make sure that our seniors are safe, if we can make sure everybody is tested and that this virus isn't passing from facility to facility and resident to resident via the staff.
Now, I want to ask you a difficult question because, you know, there's limited funds available, but let's say, you know, we do have an elderly patient in a long-term care facility and they have diabetes, they have heart disease, they have another underlying health condition. How far should the state go to protect them?
The state should go to all ends to protect them, and that I'm not seeing that being done right now. There are going to be underlying conditions across the board, but it's especially dangerous if you're older. And now you have this virus being brought into your building. So the state has to go as far as you would go for your own mother to take care of these people. So it doesn't even matter what it costs. The governor just got $1.8 billion from the federal government. That money should be spent where 80% of our deaths are happening in long-term care facility, yet it's not being spent there.
Now, the editorial that I read, that I referred to, said most often that the virus is entering long-term care facilities through staff and contractors. You would like federal CARES money to be spent on universal testing. So how often should staff members be tested? Should it be mandatory? How do you keep these facilities safe?
And that's what's been so frustrating right now is the battle plan talked about it and they're having conversations and they're having discussions, yet nothing has been done. These staff members want to be tested. Right now, we have 1,700 facilities throughout the state. Only 39 of them, 3 months in, are being tested. And we don't know how often they're being tested, what criteria is around that. How do they pick which of these facilities are being tested? Are they going in weekly or every few days? We have no idea on what's happening with the testing. We need to put all hands on deck with this testing, spend the CARES money there. What's happening right now is staff is being asked by their facility, whether it's Presbyterian Homes or Ecumen, to go to their own doctor, use their own insurance, or pay out of pocket to get these tests at $150 a pop. Why isn't our government paying for those tests? That's what I've been calling on. We've got $1.8 billion. The government should be paying for this testing for everybody. It's the only way we're going to get rid of this virus and keep our seniors safe.
Senator Karin Housley, I want to thank you.
Thanks, Shannon.
Since 1904, the beautifully ornate Governor's Reception Room in the state capitol has hosted heads of state and welcomed visitors. Brian Pease of the Minnesota Historical Society tells us more. The Governor's Reception Room, with its delicate woodwork, velvet curtains, and chandeliers, is probably the most intimate and ornate room in the Capitol that the general public has access to. In old photos, it was arranged more like a formal living room, with the furniture style changing as the times changed. Today, it is mostly used for gubernatorial press conferences. How has this room, the use of this room, changed from 1905 to today?
Yeah, it really has seen a significant change over its use over time. At one time, the large oval table was in the center of the room, and that was the meeting room table. So when the governor was meeting with executives or legislators, that was usually where they would meet to kind of work things through. And there were desks here, so there wasn't enough room for every governor's staff person to have their own office, so there were 2 roll-top desks here in 1905. And then eventually those moved out. And as times changed, you know, the carpet would wear out, colors and styles would change, so then we would see a change of furniture here. So what we see today in this room wouldn't have been here until the 1980s. Probably from the 1920s and 30s, it was here and then was gone because they wanted to put in new carpet, put in new furniture. So when you look at the appearance of this room today, it really does look pretty close to what you would have seen in 1905.
Off to our right, there's a table that has a sign that says, "Please do not place anything on this historic table," and it's never used. Everybody always wants to know what's so special about this table.
Well, it's a table designed by the architect, Cass Gilbert. It's an oval table, one of a kind in the world for this room. And so everything that you see when you walk through the building, Cass Gilbert, the architect, had his hands in designing the furniture. So he wanted special pieces for those special spaces. And this is one of those premier pieces, a beautiful mahogany, beautiful curved details and curved wood in there. So it's really a showplace. And it would have been underneath the chandelier, so it would have been the focal point when you walked into this room. That's the first thing you would have seen was that beautiful table. And we just, it's a historic artifact, so we don't want people putting drinks or leaning on it, you know, possibly doing damage to that special piece. Yep.
Yeah. This room is so beautifully decorated with the artwork and the woodwork, the lighting. Can you describe some of the finer details?
Yeah, there's a lot of symbols, a lot of things to remind people that this is Minnesota's state capital. So once again, you're looking at a room that's trying to talk about Minnesota's progress and prosperity in 1900. And so when you look at the details, you have decorations that talk about kind of the classical, kind of the Italian Renaissance themes, but integrated within those classical themes are North Stars for the North Star State. You have wheat and corn as part of the decoration to talk about the rich agricultural history and the present time at that time, the importance of agriculture in our state, and it still is today. And then we have pine cones and pine needles for the forest industry and the timber resources in northern Minnesota. So when you walk into this room, you're looking at the people who were building this building, talking about what was making Minnesota prosperous at that time. And it's agriculture, forestry, different industries, the history, the culture, all come together to make this very special room in the Capitol.
The Minnesota Capitol is essentially a monument to the Civil War. And within this room, in the anteroom that you walk through, there are 6 striking paintings of Minnesota's contributions to the Civil War. How remarkable is it that there are these paintings of Minnesota's contributions in this space?
It really is a unique depiction of the Civil War of any state capital that I'm aware of. You might have 1 or 2 paintings or things that will talk about the role those citizens had of a different state. Well, here, Cass Gilbert knew he had to bring in the Civil War flags because those were always on display in the first 2 capitals. So that was a tradition you had to bring and incorporate back into this new building. But he also wanted this room to be pretty plain, kind of white enameled paint, very simple, kind of gilded, you know, decorations. But he got pressure from the Minnesota Historical Society at the time and Civil War veterans to say, you know, we've heard you talking about these allegorical paintings, that's good, but what about the events that we were a part of? We want those to be put in some place in the building. So Cass Gilbert redesigned this entire room to reflect those Civil War paintings and 2 other paintings that were removed recently, just to remember those men who served in those battles of the Civil War.
One of the most famous battles of the Civil War is the Battle of Gettysburg, which is represented in this room in a painting by Rufus Zogbaum. Can you tell us more about that?
Yes, it's an important part of American history because the men from the 1st Minnesota Infantry Regiment, the first 1,000 men that were tendered or offered to fight for the Union Army, and that second day of that 3-day battle were ordered to plug a gap in the Union line that had been opened up by advancing Confederate forces. And by 1863, they had been in war for 2 years, and they'd been in Antietam and Bull Run and been in major campaigns in the peninsula. So they lost a lot of men in that time period between 1861 and 1863. So their fighting force was pretty small speaking when you're looking at thousands of men in the battlefield. They had less than 300 men. And they knew when they got that order to plug that gap in the Union line, they had to fix their bayonets. It was basically a sacrificial charge. They just had to buy time for reinforcements. Not one man wavered or flinched. They all made that charge, bought the time they needed for the reinforcements to plug the gap, but they lost 82% of their men. So 8 of every 10 of them were either killed or wounded in that 15-minute charge. And so that was the one scene that you wanted to portray in your brand new capital, the sacrifice, not only of those men, but a lot of historians and even the generals at that time said if they hadn't made that charge, the whole outcome of the Civil War could have been completely different. So that was one of the defining moments of that battle. And of course, for those men that survived, a defining part of their life.
And another painting in here is the Battle of Nashville, which is known for being one of the most realistic portrayals of a battlefield scene. There's snow on the ground, the grass is downtrodden, there's smoke in the distance, the flags are in tatters. Tell me more about this painting.
Yeah, this is considered one of the masterpieces of any Civil War art in the world. And we have it here, and that's one of my benefits. I get to see it every day when I come to work. But it really is telling you a graphic story of what it was like to be in a Civil War battle. Howard Pyle, the artist, doesn't romanticize anything. He has, you know, all the generals, all the officers are in the background. What he's portraying is those privates, the corporals, the sergeants who are making this charge across 400 yards of muddy cornfields. They were wading through that muck and the mire, getting to the Confederate defenses. And they were, once again, the 4 Minnesota regiments, the 5th, 7th, 9th, and 10th, had a pivotal part of that battle and helped push the Confederates out of their defenses outside of Nashville and help turn the tide of the battle. So when you look at this painting, it really gives you a graphic depiction of what these men were like and just the chaos. As you mentioned, the flags are shredded because there's hundreds of bullets zipping through the air, and the men are low to the ground to get under waves of lead flying over their heads. And so when you look at, you know, I'm sure a lot of these Civil War veterans were like, wow, this is pretty accurate depiction of what it would be like to be in one of those battles. And so Howard Pyle even is an artist who liked to put himself into the paintings. And so he is quoted as saying, when I painted that Battle of Nashville painting, I would often have to step outside my studio to clear my lungs of the smoke and the powder. So he was an artist who put himself in the middle of that scene. And when you look at the drama and the intensity of that depiction, it's almost like a photograph, 1 second of time where you see figures coming into the frame and out of the frame, kind of in a blurring motion. And so it really has a huge impact on what it was like to portray a Civil War battle.
You've been here for many years and thousands of people have come through this room. What do they take away?
I think the first thing they take away is the grandeur of the space. When they walk into the room, it's pretty impressive. And it's a place where the governor has an office, but it's also a place where he addresses the public. So it's a stately room. It's a place that has had governors from different states come here, presidents of the United States, foreign leaders have visited with the governors over time in this one room. And so it really is a show place to tell people about Minnesota. And I think the governor, every governor has had a lot of pride in being able to use this space for that purpose.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.